what does it take to return to play or return to participation for an athlete? It is a 6-step graded return to recovery, and so what we're going to do is go through each one of these stages. Stage 1 is rest. Our goal here is to reduce the frequency and or intensity of any symptoms and or to dissolve evidence of any symptoms. So we're going to evaluate the patient as we are going to outline, and therapeutically we can use chiropractic, we can use low-level laser therapy, we can use some metabolic nutrition, we're going to use some acupuncture, vision training, hyperbaric oxygen therapy, and brainwave training. We can provide many combinations of things here to help the patient alleviate their symptoms. So no physical activity that will raise the heart rate above the resting rate. So you can perform non-vigorous isometric stabilization exercises for the neck only. Stage 2, we're going to reintroduce exercise. So here our goal is to establish the ability to raise your heart rate through cardiovascular activity without symptoms arising or without symptoms being worsened during the exercise or after. So we're going to begin the exercise. Now, we recommend you start with a stationary bike so that there's no head movement. With a progression of intensity and or duration, do not increase both intensity and duration in any session. So we're going to start at, now obviously if this is a older patient whose resting heart rate is 80 beats per minute, we're not going to start at 120 beats per minute. So let's just consider the high school or the college athlete. So we're going to start at 15 minutes at 120 beats per minute. So then 3 criteria we want to meet here. Is there any increase in symptoms during that 15 minutes? Any increase in symptoms after the activity? And the next morning, any symptoms increase still lingering? If obviously if all 3 of those things are happening, then stop the exercise. Do not proceed. Need to wait longer, administer more treatment. If problems developing during the activity only, then we don't increase it. So our recommendation is, okay, if you can go no problems during that 15 minutes, no problem, exacerbation of symptoms, no problems a couple hours later, no problems the next morning, then you're okay. Do that for 3 consecutive days, then you can increase something. So you can increase the time, okay? So I would suggest increasing the time to 30 minutes. Now this might be too much for people. So again, we're going to use the same criteria, an exacerbation during, after, or the next day. If it is, then 30 minutes is too long, go back down to 15 minutes. Assuming that second phase of increasing duration, 30 minutes at 120 beats per minute is tolerable, then we're going to increase 1 parameter. So now we're going to stay at 30 minutes but go to 140 beats per minute. Again, same 3 criteria, an exacerbation during, after, next day. If not, after 3 consecutive days, you can change another parameter. So 30 minutes at 140 beats per minute with 1 minute maximal sprint every 5 minutes. So I would suggest 10 minutes at 140 beats per minute, 1 minute sprint, 5 minutes, then a 1 minute sprint. So you might get 4 sprints on the first time doing this. So again, we're going to slowly integrate these things. You must monitor this closely. Somebody must be monitoring this closely. And you'll see in a lot of professional athletes, well, they'll try to do this 1 day at a time. So if the 15 minutes at 120 beats per minute is fine, no problems, then the next day they'll go to 30 minutes, then the next day they'll go to 140 beats per minute. So they'll do this in 4 days as opposed to 12 to 14 days. So stage 3, low-level activity, our goal here is to create capacity for 30 minutes a day of sport-specific movements with progressive acceleration of the head without any symptom aggravation during or after the workout. Here we need sport-specific movement most relevant to the sport the person is in with gradual progression of intensity or exercise and magnitude or head acceleration. So for a basketball player, it can be jump shots. It can be dribbling up and down the court. It can be doing dribbling drills like a figure of 8 or crossovers or many different things. The same thing with a soccer player or a hockey player. So these are drills that should be, if you will, mindless handling drills. The drills should not require decision making or concentrating other than the basic movements. So we do not want cognitive burden drills. So no resistance training at this stage either. So again, just repetitive execution of drills, dribbling in a figure of 8 around cones, dribbling backwards and forwards, doing puck handling skills, doing jump shots, doing layups. Okay, nothing that requires you to think while you're executing. Stage 4, intermediate activity. Our goal here is no symptom production or aggravation after 30 minutes a day of sport-specific training. So here we're going to add in cognitive and visual tracking tasks and body weight resistance exercises. You don't need external weight, you can use your body weight. So for example, push-ups, sit-ups, easy things to do, things on an exercise or a physio ball. Okay, then we're going to do some cognitive tracking skills. So passing the ball up and down the court with a fellow athlete, passing the puck up and down the ice with a fellow hockey player, doing things that are sports specific. So we're going to continue with intensity and duration of the sports specific drills from stage 3. We're going to add an element of thinking or decision making, ball or puck handling, shooting, passing, executing a set play. Now I would not suggest executing a set play in soccer where you're going to head the ball. So we can add 15 minutes per day of body weight floor exercise like planks, push-ups, squats, lunges, sit-ups, box jumps. We're going to progress from less intense exercises like planks to more intense like box jumps, but do not hold your breath during the exercises. Stage 5 now is submaximal activity, so our goal here is freedom from symptoms in situations that simulate all aspects of normal training or play except the risk of collision. Sports-specific drills should involve increased complexity simulating game situations, and there should be increased duration toward normal daily training load for the sport. Resistance training, we're going to add weights or machines typical of the training programs in the sport. Heavy resistance exercises may involve breath holding during heavy lifting, which increases intracranial pressure. So you want to make sure these patients continue to be monitored when they have to do breath holding exercises if it's required in a sport-specific training exercise. And finally, stage 6 is full physical activity of sport, return to play, return to participation, so unrestricted activity without symptom production during, after, or the next morning, and so they are totally cleared for full participation. So the big question, Doc, when can I go back in? This is the first question an athlete and their parents are going to ask you. How are you going to answer this question? And here's the metrics that we've created in order to do that, so that this athlete knows, okay, the family wants to know, when is my child's brain back to normal? And when all those areas are in the green area, obviously the closer they are to the black area, the more optimal brain function is, but we at least want them all in the green area. Then we know that they are at optimal brain function. And again, at that 12 o'clock position, we've got the return to play. And at the 7 o'clock position on this, we've got the return to learn criteria. So in this particular athlete, they are both at phase 1 and phase 1, which is rest on the return to play, phase 2A on the return to learn. So very little activity in this person to begin with.